Now, we recently told you the CDC says it has plans to drop the 5-day COVID isolation guidelines. Under the new guidance, Americans who test positive for the coronavirus no longer need to routinely stay home from work and school for 5 days. Instead, they may be able to return to their routines if they've been fever-free for at least 24 hours without medication. The same standard applies to flu and RSV cases. Joining me now is Dr. Natasha Bhuyan, National Medical Director of One Medical. Natasha, this is interesting because not all health professionals agree with these guidelines.
Yeah, this has been controversial in the medical community, and the reason why is because the science around infectiousness hasn't changed. So somebody who gets COVID can actually be contagious and spread the virus for on average 5 days. Now, that can be shorter if they're healthy and they're fully vaccinated, or it can be longer if they're older and immunocompromised. But what the CDC is trying to do is they're trying to align the recommendations for COVID with other respiratory viruses like the flu or RSV.
Right.
But the difference is, despite vaccines and despite treatments, COVID still kills and hospitalizes more people than the flu. And that's why this decision's controversial.
Well, and that's why it's so much more serious when you lump it into the other respiratory illnesses. So bottom line, what do you recommend?
Look, it might not be a one-size-fits-all, but what I tell my patients is if you are sick, stay at home. That's so you can recover and get better, and so you don't infect other people around you. But I also understand it might not be practical for everybody. Not everyone has paid sick leave, so economically they might not be able to stay at home. Right. If that's the case, I do tell people if you have to work, if you have to go to school, wear a mask for 10 days. Okay. Also, get vaccinated. Only 22% of adults have gotten the updated COVID booster, and only 12% of eligible children. And so that's important to get vaccinated. And finally, I do tell people who are immunocompromised, who are older, just to be cautious. When you're in crowds, when COVID cases are going up, you might want to wear a mask. And so it really might not be one size fits all at that point in the pandemic.
Okay, great advice. Natasha, thank you so much.